second line of questions would be in reference to the funding warning from the Board of Trustees. They issued a funding warning last year again. Is that correct?
That's correct.
Okay, and under federal law, it's a requirement the President should submit suggested corrections within 15 days submitting his budget. Did he do that?
Not to my knowledge. That's not to say it didn't happen, but not to my knowledge.
Okay, well, not to my knowledge either. Now, and I don't know if you participate or listen in, or are you present at the Board of Trustees meetings?
I am present, yes.
Okay, and that would include Secretary Geithner, Secretary Sebelius, Secretary Solis, and 4 others. Have they expressed any concern that why the President has failed to lead and provide what's required under the law, which is give us some solutions? What has been the discussion amongst those members of the Board of Medicare Trustees?
To the best of my recollection, the discussion has not involved the statutory requirement on the reaction to a Medicare funding warning. It's much more focused on the financial status of the Medicare and Social Security trust funds.
Okay, so they have expressed no concern, at least in those meetings, as far as the failure of the rest of the administration for not meeting the requirements of the law and giving some direction on how to solve this serious funding warning?
That's correct.
Okay. That's pretty disappointing to me, especially we have 7 members of this Board of Trustees. Secretary of Treasury, who has been before our committee, Secretary Sebelius as well, Secretary of Labor, and 4 others. And we still fail to have any solutions being provided to them, which is a very serious warning. And I know others in the committee have mentioned that there have been few, if any, people that are concerned about the future and are not recognizing the problem. Well, apparently the administration is not only not recognizing the problem, but refusing to follow the law and provide some corrective suggestions, corrective legislation. Do we anticipate that, Mr. Foster, have you heard anything within the Medicare Board of Trustees, whether that they might provide a solution this year from the administration?
The Board of Trustees traditionally has not acted in policy matters to come up with recommendations for specific things to change. Mm-hmm. They call attention to the financial status, they call attention to the need for change, but they do not make recommendations. Mm-hmm. Now, others in the administration have thought about, of course, the President's budget that was just released has a number of Medicare proposals in it. But these tend to stem more from OMB and from CMS and from HHS, and not from the Board of Trustees.
Okay. But again, as you recognize, the Board of Trustees obviously are folks that, like Secretary Sebelius, who have a responsibility for overseeing these programs and are presenting no solutions. I'm just frustrated by that, and I know that's, I'm just curious if that came up in the Board of Trustees, the folks that are supposed to oversee that for millions and millions of elderly retirees. And we know we have a problem, but we just don't see a solution come out of the administration. I appreciate the testimony. I'll get back to you on the loss of providers, particularly in rural areas, and look forward to the research. Thank you.